we are going to go ahead and get started. So hello, everyone, and welcome to 2025. I'm Donna Rice, the Chief Operation Officer for Diabetes Sisters, and I'm thrilled to kick off this new year with all of you. As we begin another year, we really reaffirm our commitment to empowering women with diabetes through education, advocacy, and peer support, because we know that knowledge and the community are essential to successfully self-managing diabetes. At Diabetes Sisters, we believe that peer support and ongoing education are really the cornerstones for thriving with diabetes successfully. And managing diabetes just isn't about numbers. Really, it's about navigating life's challenges with confidence and really having the right support and education. And that's why we're really proud to offer our evidence-based peer support model that really serves over 30,000 women, providing them with education, resources, and encouragement. And what better way to start the year off than by discussing the power of diabetes education and peer support, which are the two key elements that can make a difference in managing this lifelong condition. So today, we're really honored to welcome Dr. Veronica Brady, a leading expert in diabetes care. Dr. Brady is an assistant professor in the research department at the UT Health Cizik School of Nursing in Houston, Texas. Her research focuses on type 2 diabetes and its comorbid conditions, including cancer and HIV. In addition to her academic role, she provides clinical care at MD Anderson Cancer Center, specializing in type 1, type 2, and the immune checkpoint inhibitor-induced type 1 diabetes. She's also board certified in diabetes care and education and advanced diabetes management, and currently she serves as the president of the Association of Diabetes Care and Education Specialists, an organization dedicated to advancing diabetes education and care. So before we begin, just a quick housekeeping note. We will entertain, and Dr. Brady will entertain questions at the end of her talk. So please type your questions into the Q&A box and we'll address as many as possible. So now please join me in welcoming Dr. Veronica Brady.
Thank you, Donna, for that warm welcome and the introduction. And I have to tell you, it is my absolute pleasure to be here with you all today. When I received the invitation, I was delighted to be able to come to a community of 30,000 women who are united together around a single purpose and a single focus. And it is my pleasure today to share with you a talk that I have put together as it relates to, and I want to be sure that you can see my screen. If somebody could give me a thumbs up that you can see my screen, I'd greatly appreciate it. And I don't see any thumbs up, but I trust someone will holler out. Can you see it? Okay, awesome. Thank you so much. So as I was putting together this talk, I thought about the value of peer support and diabetes self-management education and kind of what my thoughts are around that and what it means to me. And as part of this webinar, what I would expect you to walk away with is a clear definition of peer support. And I'm going to talk a bit about diabetes self-management education. And hopefully you will recognize the benefits of peer support and diabetes self-management education. And sometimes we use that what's in it for me term. And a lot of times when we approach things, we do think about what's in it for me. Well, I believe there's a lot in it for us as women as we think about peer support and diabetes self-management education. So first, let's talk a bit about peer support. And I will tell you, as a person who has been blessed with 3 sisters, I have a lot of peer support from my sisters around issues as it relates to being a female in today's society. And so they do offer me some peer support, but I also get peer support from my colleagues at work. I get peer support from my friends at church. So there are a number of places where we embrace our peers and get that support. But by definition, peer support, as it says here, is a form of assistance from individuals who have similar experiences. They have similar emotional challenges, and these relationships provide us with that emotional, practical, and social support. And those are the things that we provide to each other in our peer groups. Support is often found in groups where the members share common issues. And I know for Diabetes Sisters, that common issue is around diabetes, but not just around diabetes. There are some other common issues that we share, whether it is, you are living with diabetes and you have children and you're experiencing empty nest, or you have career challenges as you attempt to manage your health as well. You can kind of bond around those common issues. The goal of peer support is that in those similar situations, you get that understanding and that empathy, encouragement, and that good sense of community and mutual aid. And that is something that is really important as it relates to peer support. It's that feeling that you're not alone, that feeling that there are others here with me who are facing similar challenges, they're dealing with similar issues, and we can share knowledge not only with the people who are going through those things at the same time, but we can share what we learned with those who are coming behind us. So if we are older or more seasoned in our journey as it relates to our womanhood or our diabetes journey, we can really help to share those experiences. And as I dug into peer support and really thinking about, how does it impact us? How does it impact how we live? How does it impact our relationships? Some of the things that I gained an understanding of is without peer support, we do feel isolated. And you feel like maybe you're out there by yourself. Nobody knows what you're going through. And those feelings of like isolation can sometimes become overwhelming. It can make you feel like, why should I continue? Nobody cares about what I'm going through. Nobody understands what I'm going through. And it can cause a lack of motivation. A lack of peer support can also impact our self-esteem as women. It can lead to decrease in happiness. And one of the articles that I read said it can lead to suffering. I kind of question that suffering, because that can mean different things to different people. But certainly without that peer support and knowing that somebody is in this journey with me, somebody understands the things that I'm going through, there's somebody that I can talk to at the various stages of this journey, you can experience some isolation and decreased motivation. But by that same token, the benefits of support, you improve how you feel. I put fail, sorry, that you want to improve how you feel, not fail, about yourself with diabetes. It really helps to learn from the lived experiences with others. And I want to talk a little bit about that lived experience, because sometimes I sit on the opposite side of the fence. I have family members who have diabetes. I don't have diabetes personally, but in my care of people with diabetes, I often get the question, well, do you have diabetes? And if as a provider, we don't have diabetes, sometimes it feels like you don't understand what my lived experience is. And in some of the other disease processes that I work with, people who have type 2 diabetes and HIV, or type 2 diabetes and cancer, what I see is people really want to know and learn from people who have the lived experience. They want to know that the person who is giving them advice or helping them along the journey know what it's like. And while I may not personally know what it's like, I've been in the space long enough and I've listened to enough, or I shouldn't say enough, I've listened to many of my patients who do have the lived experience that I have learned from. But as a peer support group, it's so important to have that person with the lived experience to tell you, you can make it, you can do this. And I tell anybody, I understand that having diabetes is like having a part-time job that you cannot get away from. You have to go, or a full-time job, in many cases, a full-time job. You got to go to that job every day, whether you want to or not. There are things you have to be attentive to in order to manage your health. So having somebody who understands that day-to-day challenge is so important. Having that peer support helps to improve your quality of life. It provides you with that emotional support, and that peer support can also be of benefit to your family and your care partners. So they may not be in the same peer group that you're in or the peer support group that you're in, but they may need a peer support group of their own as they help you along your journey. So peer support is important for all of us. And as we delve into that peer support, the other thing that I want to talk about today is diabetes self-management education. And when I looked at the Diabetes Sisters website, I was really pleased to see that the components of diabetes self-management education are throughout the Diabetes Sisters on their website, and there are various places that you can go to get the information as it relates to the components of diabetes self-management education. So on that website, when you sign in, you can certainly see that you have access to information about being active and monitoring and taking medication and healthy coping. So the six of the six of the management, self-management education components are there. The only component that I don't see listed and spelled out there is problem solving. But the components, most of the components for diabetes self-management education is there. So let's talk a bit about diabetes self-management education. And this is part of the, what's in it for me. So diabetes self-management education is education that is provided by a person who is qualified to provide you with information on the 7 aspects of that care. And we'll get into that in just a little bit. But diabetes self-management education, though the people providing that education can be registered nurses, registered dietitians, they can be physicians, pharmacists, exercise physiologists, but we're all coming from that same place. We have undergone some training to understand how to deliver the education as it relates to the various components of diabetes self-care behaviors. And while we understand that any time is a good time to see your diabetes care and education specialist, that person who can really kind of sit down with you and walk through some of if you've got issues with problem solving, if you've got questions about medication, that diabetes care and education specialist is there for you on a one-on-one individual basis. By that same token, diabetes self-management education is usually a benefit that is offered and covered by your insurance. Medicare covers it, most private insurances cover it. And it is something that, yes, it does require a referral from your healthcare provider. And it is something that if you haven't had a referral to diabetes self-management education, you should request it from your healthcare provider. Access to the diabetes self-management education should be provided at the time of diagnosis. It is certainly something that sometimes you need a refresher because there's new information coming out. There's things about the different medications or the different monitoring systems, but there's new information that comes out as it relates to diabetes. Sometimes it feels like on a weekly basis. And if you have questions about it, you can certainly ask to be referred back to diabetes self-management education or request to see your diabetes care and education specialist. But once a year, you have the opportunity to kind of refresh, to re-up your knowledge, or if complications arise. If you are experiencing some difficulties reaching your glycemic targets for whatever reason, and you feel like that education that you had initially would be beneficial, you can certainly request that your healthcare provider provide you with a referral. When there are transitions in care, whether it is you've been living independently and now you're moving to an assisted living situation, whether you are of childbearing age and you are pregnant, you should certainly be in care and be receiving additional education. But whatever that transition in care is, you were on using diet and exercise as a way to continue to reach your goals as it relates to your diabetes, but now you're requiring medications. That transition is an opportunity for you to retake those diabetes self-management education courses. And that education can be offered in a variety of ways. We talk about peer support. And when we talk about peer support can be, you and one other person in a similar situation. But peer support can also be a group of you, 7 to 20 folks with similar circumstances that are supporting one another. So that diabetes self-management education can be offered in a peer support setting or a group setting. It can be offered individually. It can be offered using technology. So there are a variety of ways to get that education, but that education is imperative because that education provides you with the tools that you need to be successful in your diabetes journey. So let's talk a little bit about some of those components of diabetes self-management education. And we all know, we have heard things as far as food is medicine, and we know that certain foods impact our blood glucoses differently. And healthy eating is a huge component of one of those pillars for diabetes self-management. So we used to talk about it as a three-pronged stool. You talk about the diet, the exercise, and the medications being that third prong of the stool. But healthy eating is something that is unique to all of us. All of us don't eat the same foods. All of us don't eat at the same times. We've talked about intermittent fasting and the effect that that has on blood sugars. So that healthy eating component really helps to give you a deeper and a better understanding of the different foods and the different ways that foods could impact you, and it helps to give you some meal planning ideas. And so there's a lot of education that goes around that. The second component here is being active, and activity looks different to all of us. In my practices in the past, I had people that tell me, well, I cannot go outside and walk. I said, well, do you have stairs in your home? Do you have stairs in your apartment? Can you walk around your dining room table? Or people would tell me, I can't exercise for 30 minutes, 5 days a week. Well, can you do 5 minutes in the morning and maybe 15 minutes in the afternoon and another 10 minutes in the evening? So that activity, it talks about ways of incorporating that physical activity into your daily life. Because what we know as diabetes care and education specialists is that one size does not fit all. But we are here to help you find that size and that rhythm of exercise that fits your daily schedule. Our third component here is monitoring. And primarily we're talking about monitoring of blood glucose levels, but also of blood pressure and any other health indicators that you are dealing with that impact how well you are able to manage your diabetes. And monitoring of blood glucose levels, we have a number of different ways of doing that now. It's not always now about poking your fingers, but it is wearing the various sensor devices, and they kind of come in various shapes and modalities. But it is also keeping track of that blood pressure, because I will just say here, one of the biggest things that people with diabetes face is cardiovascular disease. So when we talk about monitoring, we're talking about more than looking at those blood sugar numbers. That blood pressure is very important, but other health indicators are also important. The fourth thing being taking medication and understanding how that medication works, knowing that if you are on a pill, some of the pills cause you to produce insulin more quickly. And so knowing that you need to eat if you are taking that particular medication, knowing the timing of your pills or your various diabetes medication, knowing how to take them maybe in combination with one another or at what times of day to take them, and how that medication along with activity impact your blood glucoses. So it's knowing all of that about medication. So we spend time talking about that. Problem solving is probably one of those things that is far and away the most personalized, because we don't all face the same problems. And that problem can be things anywhere from I don't have sufficient transportation to get to my healthcare provider appointments, or I don't have the time in my schedule to really be attentive to myself. And it's helping you to work through some of those decisions and problems that you have to solve every day. Next is healthy coping. And I know with Diabetes Sisters, you have a lot of support around coping, managing stress, and some of those emotional challenges. And that peer support is another way of healthy coping and helping one another to have that balance and that person to bounce things off of. So healthy coping is really tools and techniques to managing stress and any of the emotional challenges that you may face. And lastly, reducing risk. When we talk about reducing risk, we are talking about ways to prevent diabetes-related complications, talking about those checkups and the preventive care, whether it is things like the appropriate vaccinations, eye exams, foot exams. So any of those things around reducing risk or minimizing complications related to diabetes, those are the things that we talk about in this particular section of the diabetes self-management education. So that diabetes self-management education is designed to really encompass the majority of the factors that you may experience. So I wanted to, as a researcher, I just wanted to give you some scientific information as it relates to the benefits of peer support combined with diabetes self-management education. In studies, we have seen that combining these helps to decrease A1C by 0.4%. So getting from an A1C of 7.5 down to 7.1. Group interventions are more effective than one-on-one. So having a peer with you, even if you're interacting with your healthcare provider and you take a friend with you, having that peer support really does improve the outcomes. The shorter duration of education. So if we're doing diabetes self-management education, if we do it in kind of chunk it and in smaller groups, we know that that is more effective. And peer support with frequent contact. So if I am meeting with the people who support me at least once a week, it really helps me to stay engaged with my diabetes health, and it helps to improve A1C. And also that peer support combined with diabetes self-management education decreases diabetes distress. So the last slide I'm going to share with you is something that I use AI just a little bit, and I wanted to kind of see what I could come up with as it relates to AI and that acronym SISTERS. And I really enjoyed it. So the S in SISTER stands for support. And the other words are mine. Someone to lean on, somebody to be there with you in the fight. And I tell you, my mascot for diabetes was often a knight with a sword, and he was called my diabetes warrior. But there's somebody to be in that fight with you. The I stands for insulin, which is a means to reaching glycemic targets. It's not the only way to do it. The S is for self-care, and that self-care is a necessity. Because if you don't care for yourself, there's nobody else that can care for you like you care for you. So self-care is a necessity. Testing as it relates to blood sugar here, but it's about more than just the numbers. It's about more than just the numbers, because the numbers will go up and down. So it's finding that balance in the testing. And education, because as you know, as being members of Diabetes Sisters, knowledge is power. The R is for resources. So it's whether it's a resource of a clinician, the technology that you use to help you get to goal, educational materials, whatever those resources are. And S is for symptoms. So identify the source of that symptom. Is it an emotional symptom? Is it a physical symptom? So that is sisters in the diabetes journey. And I will stop there.
Thank you. Thank you, Dr. Brady. If you could go ahead and take down your slides, that would be
I
great,
will
because
do
then you will
that.
be in the spotlight.
Okay.
Hold on 1 second. Okay. Okay, so really thank you for an excellent presentation. I just think there's so much value in peer support and diabetes education, and we really thank you for kind of like bringing that to life today, because it really reinforces the vital role that I think Diabetes Sisters and ACDES and the whole education arena really plays in the management of chronic disease. And, you know, thinking about this too, so many of our members that have been with Diabetes Sisters for a really long time, and new ones really can attest to kind of like the value that we have been bringing to them in their journey with diabetes. So I'd like to kind of right now open it up to question and answers from our members or our people who have joined the call. So if you haven't put your question or your comment in the Q&A, please go ahead and take a minute to do that, and then we'll go ahead and get started. So we do have a question that came from Linda, and it says, peer support has been incredibly helpful for me. I've been involved with Diabetes Sisters for over 6 years. How could we amplify our voices to really promote the importance of Diabetes Sisters?
So I think amplifying the voices is partnerships. That's how we amplify our voices. And as Donna and I talked about, it is our combined voice that gets heard. And so as the president of ADCES, our goal is to partner with Diabetes Sisters so that we can get that message out there. And as a researcher, knowing that people who are dealing with chronic diseases need that peer support, taking that message farther and wider. And it's one of those things of, you know, you benefit from this. Tell somebody else about it. Tell your healthcare providers about it. Because oftentimes as healthcare providers, we don't think about peer support. So if you talk about the fact, I belong to Diabetes Sisters and I get so much benefit from it, and there may be other people in your practice who may benefit from it, that is putting it out there. So that's how we get to amplify our voice.
Beautiful. Yes. And at Diabetes Sisters, we're really working on the advocacy angle too, with our partnering organizations like ACDES to really kind of like really be on top of what's going on both in state and federal. So I think that's another way that our members can also get involved too. So all good. So here is another question from an anonymous attendee. Is the education specialist helpful for somebody with prediabetes too?
So I will tell you, the diabetes care and education specialist is helpful in that role. They have a particular program called the Diabetes Prevention Program, or the DPP, which is designed for people with prediabetes. And what that course is, it usually is a several-week program, and it also talks about some of the components of diabetes self-management education. So it does talk about healthy eating and physical activity and things like that. And it is designed to help prevent prognosis or progression to diabetes. So our course is designed for people with prediabetes.
Yes, and at Diabetes Sisters, we're going to be launching the end of February a workshop, a peer and professional-led workshop on people at risk and prediabetes. It'll be the last Tuesday of the month. So please absolutely go to our website and sign up for that. Great question. Here's a question from Carol. Can Dr. Brady flush out or give an example of possible types of problem solving?
So I will tell you, for me, problem solving that I've seen most often is around timing of medications, or figuring out, give me just a second. Let me think about a really good one that will be helpful to you. So problem solving, it just occurs for people in various ways. So if the issue is that I don't have enough resources to meet the needs of myself and my family as it relates to diabetes and diabetes care. Problem solving may be that we come together and we find out what resources are available in your community. We may find out that as an older person, one of the things that I did, Meals on Wheels will deliver food to you so you don't have to use some of those finances for food that you would normally need to use for medications. Other problems may be around medications and taking of medication. So one of the things that I've had in the past is a person who had limited vision, and they go to their primary care provider or their healthcare provider, and they are telling them, well, you need to inject X amount of insulin. Well, one of the problems that I could help them with was maybe you listen to the clicks on a pen. So it's various things like that that we can help you with as far as problem solving. If you have a problem in particular that you would like to share, then I could probably be a little bit more useful, but it all depends on what the problem is. It all depends on what the problem is.
Yeah, very good. And two, just thinking from a clinical perspective, somebody with diabetes, I mean, every day they're juggling like with exercise, high blood sugars, low blood sugars, and how you think through that. And just to let everybody know, the content developed at Diabetes Sisters is all based around those 7 self-care behaviors that Dr. Brady talked about. And we have weaved problem solving throughout all of those modules and the educational materials that we have in our resource center as well. But every day people are problem solving, making many decisions related to their diabetes. And so for those of you who are really new, it's something that you're thinking about, and problem solving may seem like, well, how do I do that? And keep in tune with Diabetes Sisters, because every month we do address those key things within our content and everything that we're talking about. Well, good. And then Carol also has a question. Is there a state or local directory on how to find a DSME provider? And is there a website? And we could certainly send that out, but you might want to just say what it is. Yeah.
Yes, so if you go to the Association of Diabetes Care and Education Specialists, and it will say find a DSME or find DSME or find a CDS in your area, and you can put in your state and your zip code, and it will tell you the center that is closest to you or the education program closest to you.
And it's www.diabetes or diabeteseducator.org, right?
That is correct.
Yeah.
That is correct.
And I could put that after the next question. I could put that in the chat as well. Another question from Carol. Question answered regarding problems unknown. Okay. An anonymous center. What are some of the most significant benefits you've seen from women participating in peer support groups?
Well, I will tell you, as a person who spent a lot of time with women who were of the childbearing age, the benefits that I saw were remarkable, from things like, so I had women in various stages of their pregnancy. So it was very helpful for them if this person is in their, first trimester and this person's in their third trimester, talking about the things that they did as they progressed in their pregnancy, as far as how they managed exercise or how they attempted to minimize the weight gain, because we know there's always this issue with weight gain in pregnancy. But listening to those women, as a person who was not pregnant, has not been pregnant, I can't answer those questions for you, but listening to them talk to one another about it. Also for people who were older and talking about the fact that they didn't want to, their appetites weren't as great as they used to be. And there were certain foods that they had an affinity for, and how they could kind of balance some of that, from if they enjoyed sweets, just eating a small like fun-sized piece of chocolate, or putting the grapes in the freezer so that the grapes were frozen and sweet and took a little longer to eat. So the peer support, it all depends on what their concern was at the time, but they benefited from learning from one another. So I have seen peer support be extremely effective in this space.
Very good. And through Diabetes Sisters, we get so many great testimonials of women who have really talked about kind of the value of peer support and what they've learned, and were able to also even help other people. So we sit on about 15 years of some really incredible testimonials. And those are things we certainly share some of those comments on our website or on our website as well. So great comments. So this is great. This question comes from Eva, and thank you for joining, Eva. And it says, any connections to help with getting a diabetes alert dog?
That is a great question. And I think some of that comes through, certainly as a diabetes care and education specialist, the way that I did this was engaging with my social worker. And if the practice doesn't have a social worker, sometimes it is that healthcare provider writing a letter of need. And the problem, and I hate to say this, but the problem with getting those diabetes alert animals is that they take a while to train. So it's not they're usually not as readily available as we would like them to be. And one of my, a couple of my patients in the past told me they had basically diabetes alert cats, because the cat would sniff their breath and alert them if they felt that the sugar was high. So I think starting with, if you're in a practice and there's a social worker, you can get a referral to the social worker and they can fill out those certificates of need. If you have obtained a certificate of need, then it is having your healthcare provider fill that out, or the diabetes care and education specialist, if you're working with them, they can help you with those forms.
Yeah, and just to jump in here, and I'll find the resource, but I have actually somebody I've taken care of in the past, and their daughter is just getting one. And so I could find out the organization and get it to Eva as well, because there is an organization that does, like she said, diabetes alert dogs. But off the top of my head, I just can't remember it right now, but I certainly can help you and find that question out. Next question comes from Leola. I just wanted to say thank you for the presentation. I can attest that I tend to manage my diabetes better when I have peer support. So here's a wonderful testimony from Leola. So thank you for that comment.
Thank you.
And then another anonymous comment. What advice would you give a woman newly diagnosed with diabetes about seeking peer support?
I would advise her to join Diabetes Sisters.
Absolutely.
Certainly join Diabetes Sisters. But the other thing that I will say to you, if you are looking for somebody who is right there in your space and place, when you go to your healthcare provider's office, I would just ask, and if my patients would ask me, you know what, I just want to talk to somebody who's in the kind of the same place that I am. I get permission from the other person, and then I can connect them. So it depends on the degree of support that you're looking for. And also, if there is you can look for the diabetes self-management education courses in your area. You can also connect with people that way. But certainly joining Diabetes Sisters, and if you want somebody in your space and place, I would check with your healthcare provider.
Very good. Okay, another comment from Carol. Can we have your contact information? So we certainly could put that in the chat. And also, are there any upcoming studies for diabetes with a need for participants? And that's a great question, because I think a lot of research studies are also looking for participants. And oftentimes at Diabetes Sisters, we do post them on our website too. But I know, Victoria, Veronica, you're in a research center. So you may have ideas around that through UT as well. Yeah.
So most of the studies are usually looking at, we look at academic settings because that's kind of where they are housed. But certainly, as Donna said, they will post the studies on their website, and it depends on the kind of study that you're interested in. So for me as a researcher, I'm looking for people who have comorbid diseases. But if you are looking for studies that are drug studies, there's new medications and things coming out, there are certainly centers that do that. I personally don't participate in drug studies. So it depends on the kind of study that you're looking for. And if there's something in particular that you're looking for, if Donna doesn't know, if you can shoot her an email and ask her, or you can shoot me an email and ask me, and I can look for something for you. But it depends on what kind of study you're looking for.
Yeah, absolutely. And then also there's kind of some websites, I think, like grants or studies, clinical.
Clinicaltrials.gov.
.gov.
Yeah,
Yeah, that sometimes lists
clinicaltrials.gov.
them as well. Yeah,
Yep.
perfect. And a question from Alejandra, and I think this has been answered, but what is the easiest way to find a DSME service? And we're going to put the website in the chat, and we'll also email that out, but www.diabeteseducator.org to find a DSME program. Yes. And then here, and do they have them in Spanish? Oh, that's an interesting comment from Alejandra as well. Do they have them in Spanish?
There are courses in Spanish. Absolutely.
And probably at the same website, we can get that information for DSMT Spanish. Okay.
Yes.
Good.
Yes.
Good to know. And then what if there are no, this is an anonymous attendee. What if there are no diabetes educators in my area? Is there a directory of educators who offer telehealth appointments?
There is, and I was just grabbing that resource for you, and I'm going to put that. It's actually the website has changed, Donna. So I'm going to put that website in the chat.
Okay.
And so there you are, and you'll be able to find someone there.
Righty, and I think we have answered all the questions. Hang on one second. Last question, really quick. Diabetes management is difficult and constantly changing. Sometimes I feel like my healthcare team isn't up to date because they have so many things to do and conditions to manage. How can I stay empowered and help others keep up with the latest advancements, especially when you might not be, especially when diabetes education is kind of a one-time offering and you might not be ready for the next one. So staying in between, kind of how to get education in between all this and keep your healthcare provider. So it's kind of like a double whammy there, right?
So I tell everybody you are your own best health advocate. And if you go into your healthcare provider's office and you tell them, I would like information about X, Y, and Z, and they shut you down, that's a good time to start looking for another provider, if at all possible. But the other thing is, most healthcare providers should be happy that you are interested and engaged in your care. You have a number of resources available to you. Diabetes Sisters is an excellent resource. ADCES is a great resource for you. And both of these places and spaces, and I have to tell you, diabetes.org, which is the ADAs. So a lot of them have resources for lay people. So if there are things that you have heard on the news or you've seen a commercial about and you want to find out about, yes, you approach your healthcare provider because they're usually the person that's going to prescribe it for you if they feel that it's appropriate for you. But there are a variety of resources that you can use to gain more information about those.
Absolutely. Okay, well, I think we're just about out of time and questions. And then just before I wrap up, I just want to say a big thank you to Dr. Brady. This was great. Very, very important topic. And I just want to highlight some really important upcoming events. So on February 12th, we're launching the first session in our new type 1 diabetes screening series. And the program is really going to focus on the new talk and information around preventing the complication of DKA and delaying the onset of type 1 diabetes. So it will really be a comprehensive program. So we're going to have an informational workshop that will be February 12th, and a board certified endocrinologist will be presenting, Dr. Buhari, and she'll be presenting alongside two women who have lived with type 1 diabetes, who have had their children tested, and they're going to really talk about kind of the emotions that they went through, how difficult it was to make the decision, and was the decision worth it? So please join. And for all of you out there, and most of you are touched with diabetes, and I know many of our members have type 1, this is about your families, your brothers, your sisters, your aunts and uncles and cousins, your children. So you want to get them engaged and really understanding how we could either delay that diagnosis or prevent diabetic ketoacidosis. So again, February 12th, There'll be 2 workshops following that on the 17th and the 18th that will be led by the physician and these 2 women that will share step-by-step guidance. That's step-by-step guidance on what you do. How do you get screened? What is that process like? How do you do the test if you do a take-home test? What do the results mean? What are those next steps? And if you're positive, negative, what are those next steps? Because it's a little bit complicated, I guess is probably not the right word, but there's many steps to it. And we're really trying to simplify those steps and really make it work for you and really try to help you and your family members. So that would be on the 17th and the 18th, and one will be at noon and one will be at 7 p.m. So it's a vital program, so really don't miss it. You can sign up on our website today. Remember, the webinars are always at 12 noon Eastern and they are recorded. The workshops, the beginning of the workshops will also be recorded, and the workshops will be open to everyone, both men and women. So please join us for this really incredible program. A huge thank you now to Dr. Brady for sharing her insights today. And of course, thank you all for joining us. We look forward to all of these upcoming events. Remember, we want you to stay connected. We want you to stay informed, and we want to always continue supporting each other. So I'm glad you're all here. Happy New Year. We're looking forward to a wonderful 2025. So thank you, everybody, for joining. Bye-bye.
Thank you. Bye-bye.